Okay, from this part is seizures and epilepsy. What is seizures and epilepsy? A seizures is a transient occurrence of a sign and or symptoms due to abnormal excessive and synchronous neuronal activity in the brain. It means the brain have excessive and abnormal neuronal activity and electrical impulse. They have more electric stimulation in the brain that make the children have epilepsy. Look at this picture. Before we start, if we go to the next, students should know the function in the each part of the brain. It's not clear. I think this picture is better. Yes. Yes, you see this is green in the frontal lobe, green color. Functional personality, social skills, judgments, emotional regulation, movement, speech, reasoning, and executive function. In the pink one is motor strip. In this is sensory strip, parental lobe for deep perception, calculation, writing. Oculomotor is a sight processing visual information. Cerebrum is a very small brain in this area. Control is a balance, learning, emotional coordinate movement. If the patients drink alcohol too much and cannot walk straight, yes, this part is abnormal. And brainstem is for vital signs like breathing, heart rate, blood flow through the body. Yes. Okay. Yes. Okay, next. This is the definition of epilepsy. It means like that it's a diagnosis. If the children meet criteria of this, the children have diagnosis of epilepsy. The first is at least 2 unprovoked seizures occurring more than 24 hours apart or and one provoked seizure and property of further seizures similar to the general recurrence list at least 60%. After 2 unprovoked seizures occurring over the next 10 years. So you don't have to if you don't understand of the definition of epilepsy is okay, because it is only the definition for diagnosis of children with epilepsy. Okay, the causes of seizures in children is the example is birth injury, infection, trauma. That make the children don't have oxygenation enough. The brain of the children, the brain of the infants not have oxygen enough and have epilepsy. Fever, extracranial is like fever, heart disease, hypokalemia, hypoglycemia, and toxic is a drug, poisons like this. Okay. Okay, this is the type of epileptic seizure. There are many different types of seizures and each has unique clinical manifestation. Seizures are classified into 2 major categories. First is generalized seizures. The seizures which have generalized seizures, the children have the electrical impulsive all of the brain like this, all of the brain. Yes, the abnormal, autonormal, electrical, abnormal, all of the brain. which involve both hemispheres of the brain, and are without local onset. And another category is focal seizures. Focal seizures is which have a local onset and involve a relatively small location in the brain. They have the abnormal in the brain in the small area in the brain. That the previous I showed you about the functional of the brain from each part that you know. If the children have the seizure, you should know you will know which part of the brain is abnormal. And the general have the very subtype such as absence seizures, tonic seizures, clonic seizure, tonic clonic seizure, and focal have a many types. But I will show you only the type that the child have the most due to the time นะคะ Okay, next. The first type is grand mal seizures, or another name is tonic clonic seizures. Most common and most dramatic of all seizure manifestations occur without warning. From this seizure, if the child have a feverish seizure first time, the child will have tonic clonic like this. Yes, if the feverish seizure first time is a tonic clonic seizure like this is a tonic, and this picture is tonic and this clonic. Okay, I have a clip for you. Thank you for the clip video นะคะ This is the child that have feverish seizure. Oh, sorry, they have tonic clonic seizure. The first, they have a spasms all of the body, and no consciousness, don't have conscious. Tonic phase lasts proximal 10 to 20 seconds. Eyes roll upward. Immediate loss of consciousness. Stephens in generalized symmetric tonic contraction of entire body musculature. Arm usually flexed, legs and head and neck extend. Many utter a particular piercing cry. Increased salivation like this picture. Increased salivations and loss of swallowing reflex. Clonic phase lasts about 30 seconds, but can vary from only a few seconds to a half hour or longer. Okay, thank you for the clip นะคะ Okay, the second subtype is absent seizure. I have the picture for you. Okay, thank you for the clip video นะคะ The onset usually between 4 and 12 years of age. More common in girls than in boys. Usually increased at puberty. This girl have the absence seizure. She have loss of consciousness for a while. Brief loss of consciousness. Minimum or no alterations in muscle tone may go unrecognized because of little change in child behavior. Even possibly precipitated by hyperventilation, hypoglycemia, stress, fatigue, or sleeplessness. Usually lasts about 5 to 10 seconds. Appear without warning or aura. This girl have the absent seizures like this. That the teacher noticed and bring her to the hospital. Okay, the next part is focal seizure. Focal seizure, simple seizures. The simple seizure, the child have the awake. Okay. Due to which part of the brain abnormal? That's okay. See the video. Thank you for the clip นะคะ Yes, I think the same child. Yes, that she awake like this. She look at the mother. Look at her mother. The simple is localized motor symptoms. This is motor symptoms. Motor abnormality. Abnormal discharge remaining unilateral. Awareness of movements or loss of conscious awareness or loss of conscious. Like this child have awake. Okay, thank you for the clip นะคะ Okay, go to the next. The next is complex seizures, impaired awareness. This is impaired awareness for sure. The simple may be awake, may be unconscious. Thank you for the clip video. This is a focal seizure with impairment awareness. Observed more often in children 4-3 years of age through adolescence character by the following periods of altered behavior. Inability to respond to the environment. Impaired conscious during events like this girl. Drowsiness or sleep usually following seizure. Confusion and amnesia possibly prolonged. Complex sensory phenomena. Most frequent sensation is strange feeling in the pit of the stomach that rises towards the throat and is often accompanied by odd or unpleasant odors or tastes. Complex auditory or visual hallucinations. Ill-defined feelings of illusions or strangeness. Okay. Thank you for the tip นะคะ Next. Okay. It's only the type that children have the most นะคะ If you want to know more type of epilepsy, you should read the book Therapeutic Management. The goal of the treatment of seizure disorder is to control the seizures or to reduce their frequency of severity, discover and correct the cause when possible, and help the child live as normal life as possible. if the child has acute the drug therapy, if the child has acute TBI seizure or seizure epilepsy that's acute, maybe have several drug therapy. But if the child have the prolonged or going home, there's the doctor you give phenytoin. Phenytoin can kill both simple and partial. That have the in-click examination for drug therapy. That's I will show your video. Thank you for the clip นะคะก็รีวิว
Phenytoin is an anti-seizure medication that is tested a lot on the NCLEX because of its narrow therapeutic window and risk for toxicity. In this mnemonic video, we'll make sure you're up to speed on everything you need to know about phenytoin for test day. These troublemaking kids are playing around a phone tower. Not their brightest idea, but before we talk about the kids, let's focus on the phone tower. This phone tower will serve as your memory anchor to phenytoin. You know, a phone tower for phenytoin, because phone tower and phenytoin sound pretty similar. You may sometimes hear phenytoin called by its trade name Dilantin, but the NCLEX will always use the generic name of phenytoin. So just remember this phone tower and you'll be good to go. The phone tower has been built with these anti-shake shocks. I mean, we definitely don't want the phone tower coming down in an earthquake or other disaster. These anti-shake shocks improve stability by preventing the phone tower from shaking. By the way, these anti-shake shocks remind me of how phenytoin is used to treat seizures, because both work to stop shaking. Get it? Phenytoin is effective in treating both tonic-clonic and partial seizures. It works by inhibiting the flow of sodium ions, stopping the repetitive neuron firing that causes seizures. Now that we know what phenytoin does, let's move on to learn about its side effects. Take a look at that sign by the phone tower. It's warning people to not climb up too high on the phone tower because it's super dangerous up there. Just like people can get hurt from climbing too high up a phone tower, it's dangerous to have high levels of phenytoin in the blood. When the phenytoin level rises above a certain cutoff range, patients will develop symptoms which we call acute toxicity. So what exactly is this cutoff range? Let's find out. Back to those kids. The girl here dared her friend to climb the phone tower despite all the warning signs. In fact, she even said she'd give him two $10 bills. That's $20 for those of you keeping score at home. These are both important numbers to remember, 10 and 20. You see, phenytoin has a very narrow therapeutic range of 10 to 20 milligrams per milliliter. Below this range, the dose isn't effective and the patient might still develop seizures. However, if we go above the high end of this range, toxicity can occur, leading to many harmful side effects. Speaking of which, next, let's talk about what side effects to watch out for in case of phenytoin toxicity. Kids will do anything for $20. Despite the warnings, the boy climbed the tower and he looks like he's about to fall. You can use this boy falling as a symbol for ataxia, because ataxia is just a fancy term for impaired balance and coordination. In other words, you can expect someone with ataxia to fall or stumble a lot, like this boy. Get it? Ataxia is an important symptom of phenytoin toxicity, and as with any of these toxicity symptoms, it should be reported to the provider if noticed. The boy is yelling out for help, but the shock of the situation has caused the words to come out all slurred. Which reminds me, slurred speech is another possible symptom of phenytoin toxicity. The girl is starting to get nervous. Maybe breaking the rules wasn't such a good idea after all. She's looking side to side to keep a lookout for the authorities. The way she is moving her eyes side to side is similar to nystagmus. Nystagmus is a condition where the eyes make repetitive, uncontrolled movements side to side. This may be a pretty subtle symptom in patients, so as the nurse, keep a close eye on their eyes, okay? These three adverse effects, ataxia, slurred speech, and nystagmus, are the most common signs of phenytoin toxicity. Like I mentioned before, they should be reported to the provider immediately if seen, and you'll likely be instructed to hold the next dose of phenytoin until blood work can be verified. Last but not least, let's talk about one side effect that isn't related to toxicity, but rather is a general side effect of taking phenytoin, even at normal doses. Take a close look at the girl's bubble gum. It's hard to miss the way she's blowing it in a big bubble. Here at Pixarize, we use big bubble gum as our symbol for gingival hyperplasia, because gingival hyperplasia is really just a fancy way of saying overgrowth of gum tissue. Big bubble gum to symbolize big gums. Gingival hyperplasia is an expected side effect of phenytoin. It can often be controlled with good oral hygiene and regular dentist visits. Unlike the effects of toxicity we talked about earlier, gingival hyperplasia is not a reason to stop the medication. Alright, that's all for this mnemonic. Let's recap. Phenytoin is an anticonvulsant drug used to treat seizures. Phenytoin has a narrow therapeutic range of 10 to 20 micrograms per milliliter. High doses of phenytoin above this cutoff can lead to symptoms of acute toxicity. These symptoms include ataxia, slurred speech, and nystagmus. The provider should be notified immediately if these symptoms are seen. Another expected side effect of phenytoin is gingival hyperplasia, so encourage your patients to practice good oral hygiene and visit the dentist regularly. And now we're actually done with phenytoin. Let's be sure to keep those kids off the phone tower. See you next time.
Thank you for the quick video. This is show you what is the toxicity in the if use this drug phenytoin. Okay. The second one is ketogenic diet. The ketogenic diet is a high fat, very low carbohydrate, and adequate protein diet that has shown effectiveness for treatment of epilepsy. It is also the first line treatment of certain metabolic disorders, includes pyruvate, dehydrogenase deficiency, glucose transporter type 1 deficiency, and glutamic aciduria type 1. Consumption of the ketogenic diet forces the body to shift from using glucose as primary energy source to using fat. An individual develops a state of ketosis. The diet is rigorous. All foods and liquids and the child consumed must be carefully weighed and measured. A liquid formula is available for children who cannot take solid food. The diet is deficient in vitamin and minerals. Therefore, vitamin and mineral supplementation is necessary. The ketogenic diet has been shown to be an effective and tolerable treatment for medically refractory epilepsy with seizure control comparable to or better than that obtained with anti-epileptic medicines in some children. Okay. To look at the video again.
Did you know that about 140,000 people in Canada have epilepsy? This is a huge number, and considering that around 60% get diagnosed before the age of 20, it leaves the burden of choosing therapy options heavily on the parents. Now, about 70% of all those people who have epilepsy are put on medication as their main form of treatment. But as you can imagine, these drugs can be expensive and have severe side effects. In fact, 61% of those who reported having side effects also reported that the side effects have a moderate to extreme impact on their lives. Not to mention that the drugs don't even work on 10% of the people who are taking them. Today, I'm here to present another possible treatment option for kids who are suffering from epilepsy. What if I told you that kids might improve their epileptic seizure activity just by changing their diet? It might be surprising to some of you that this treatment has been validated by many scientists over a decade now and does not involve any medication. There are probably a ton of questions going through your minds right now, so let's talk about this diet. This diet is called the ketogenic diet, and there are a few variations of it. The classical ketogenic diet consists of an approximately 4-to-1 weight ratio from fat to carbohydrates and proteins. Let's look at what's different between the ketogenic diet and other diets on the biochemical level. There are three main differences on the biochemical level. The first one is that the ketogenic diet and variations of it led to a significant increase in the total ketone body levels in the subjects. Ketone bodies are one of the products of fat metabolism. Secondly, those on the ketogenic diet had lower glucose level after their meal. And lastly, there is a downregulation of the glycolysis pathway in those on the ketogenic diet. For those of you who don't know, glycolysis is a pathway for the breakdown of glucose. So it makes sense that when the glucose levels are lower after a meal, glycolysis is also downregulated. So let's look at the big picture. What's the point of all these biochemical changes in the body? Well, research shows that high blood beta hydroxybutyrate, or BHB, which are a type of ketone bodies, are correlated with seizure control. In a study done by Gilbert and colleagues, patients were put on the ketogenic diet and were assessed during follow-up sessions. The results showed that those who had less seizure frequency also had high BHB or ketone bodies in their blood. So what do ketone bodies have to do with it? Well, ketone bodies inhibit vesicular glutamate transport, or V-GLUT, which eventually reduces seizure activity. V-GLUT's job is to form these bubbles filled with glutamate inside the cell and then release them to outside of the cell. This is how we can have glutamate outside of the cell. So if you can imagine, if V-GLUT is being inhibited by ketone bodies, glutamate is not being released from the cell. Since glutamate is an excitatory neurotransmitter, decreasing its level in epileptic patients is expected to decrease seizure activities based on research done on rats, which share a lot of mammalian physiology with us. If you're looking for more support in favor of the seizure-reducing efficacy of this diet, there was another research done by Hottenlotcher that may convince you. A 4-year-old subject who was doing well on the ketogenic diet was infused with glucose. After the infusion, the subject's ketone body levels decreased and their glucose levels increased. And just after 45 minutes, the subject experienced a seizure. It's important to keep in mind that research shows that this diet has the greatest improvement in younger people. In a study done by Short and colleagues, the ketogenic diet variation led to the greatest increase in ketone body levels in subjects under 10 years old of age compared to those who were over 10. As always, consult a professional before making the decision of putting your child or yourself on the ketogenic diet. This diet is not just a lifestyle change, but it's used as a treatment, so it needs to be regulated by the doctor, and it's far different from the fad diet versions that you might have heard about. A variation of the ketogenic diet that is commonly suggested by doctors is called the medium chain triglyceride, where 60% of the total intake needs to be from medium chain triglyceride fat. And these fats take less time to be absorbed by the intestines. But if you and your healthcare professional decide that this is the right treatment, I've included a website in the description box which includes what foods to eat and what foods to avoid. Thank you for watching, and if you like this video, make sure to give it a like and subscribe to the Demystifying Medicine YouTube channel.
Okay, next. The last is surgical therapy that's considered by doctor. Okay. It is nursing care management during the seizure and post-tical stage.
First aid for a seizure.
Oh, Harry. You're just having one of your seizures. Don't worry. Mommy's here.
Protect them from injury.
Don't worry.
Do not restrain them.
Be all right. Just listen to my voice, Harry. It's going to check your breathing. You're all right. I'm just going to roll you over, Harry. Okay?
When the seizure is over, help them to rest on their side with their head tilted back.
Okay. That's it.
Remember, make them safe and prevent injury.
The summary: during the seizures, the nurse should remain calm time seizures episode. If child is standing or seated, ears tied to the floor. Place pillow of fold blanket under child head. Loosens restrictive clothing. Remove eyeglass. Clear area of any hazardous or harsh objects. Allow seizure to end without any interfere. Do not attempt to restrain child or use force. Do not attempt to restrain child or use force. Do not put anything in child's mouth. Do not put anything in child's mouth. Do not give any food or liquids. After seizures, time post-decal period. Check for breathing. Check position of head and tongue. Reposition if head is hyperextended. If breathing is not present, give rescue breathing and call emergency medical service (EMS). Keep child on site. Remain with child. Do not give food or liquids until child is fully alert and swallowing reflex has returned. Look for medical identification and determine what factors occurs before onset of seizure that may have been triggering factors. Check head and body for possible injury. Check inside of mouth to see if tongue or lips have been bitten. Okay, thank you very much for the clip นะคะ Okay, next. Nursing care management. An important nursing responsibility is to observe the seizure episode and accurately document the events. The nurse should describe only what is observed, rather than try to label the seizure type. Note the time that the seizure began and the duration of the seizure. The nurse should not describe what type of the seizure that the child had. No. Note only the time the seizure began and the duration of the seizure. After the seizure, after the child had a seizure, finish the seizure, stay with the child and reassure until fully consciousness. Okay. Is for long-term care if the child has stabilized and doctor allow child to go home, but mother will still anxiety and worried about the child that may have the seizures again and have the dangerous from the brain, or the child may die. That make the maternal anxiety. The nurse should educate all that mother have to do with the child, and the child have to take care of yourself too. The first is medical action and side effect. The nurse should help the parents plan the administrations of the medication at convenient times. Using the example is using a pill box can prevent accidentally missing doses. Nurse should emphasize that the child must eat medication every day. If the child is normal and nothing happened to the child, no seizure at all, or have a normal child, and the mother consider to stop the medication with herself, that no. The mother should give the medicine. The nurse must explain that if the child no seizure because of he or she take medicine, the child have to eat medicine every day until the doctor order to stop it. Okay, next. If the child have the latch that consider or may get allergic reaction to the medicine. Nurse should report immediately the child health immediately. The side effects such as excessive sleepiness if the child eat medicine. They have excessive sleepiness, change in appetite, and worsen behavior and mood like this. The chronic treatment of phenytoin may cause gum hypertrophy. That's like the clip video of phenytoin toxicity. Okay. Usually anti-epileptic medications are continued until the child has been seizure-free for 2 years. As I explained previously, the child must eat the medicine every day. Most common cause of status epilepticus in children taking anti-status epilepticus seizure. I tell you previously that the seizure that the status epilepticus seizure the child have a seizure more than 30 minutes. The most common cause of status epilepticus in children taking anti-epileptic medications is missing medication. Okay. The second is trigger factors. The most precipitating factors of seizure in children include physical and psychological stress. This is a big problem. If the parental anxiety or stress that overwhelms the child and the child may have seizures. Sleep deprivation. That means the child doesn't go to sleep the same time of every day or wake up the same time of every day. That have sleep deprivation. It's bigger factors of epilepsy. The fever and illness. If the child have the fever and they have sick, child have to go to see doctor immediately. Other participation factors include flickering lights. What is flickering light? They have the clip for you. Moment please. Thank you for the clip นะคะ This is flickering light. This the file had like this as a trigger factor. And menstrual cycle, stimulants, recreational drugs, and alcohol is like addicted drug, and alcohol is a trigger factors. Okay, the third is seizure precautions. If the child precaution for the child, if the child has seizures or not, they have to prevent the accident and the dangerous for the child. The extent of precautions depend on type, severities, and frequency of seizures. Precautions may include the following: sight realize when the child is sleeping or resting, sight real and other hard object padded with something soft for prevent dangerous, waterproof mattress or pad on bed and clip. If the child have a seizure and take a pee or poo. Okay, next. Appropriate precautions during potential hazardous activities may include the following: sleeping with a companion or a friend, showering preferred, bathing only with close supervision, use a protection helmet use this, and padded during bicycle riding, skateboarding, and skating. Okay. Have child carry or wear medical identification. Alert other caregivers to need for any special precautions. Adolescents or the older children may not drive or operate. hazardous machinery or equipment unless seizure-free for designing periods. This is called for. Okay, next. And family support. Now we have an epilepsy foundation that support epilepsy children. Parental attitudes and management of a child with a seizure disorder vary. Nurses should encourage parents to be honest and open about the disorder with their child and with others. Education materials and support groups may prove beneficial for families. Yes, I said already. Okay. Finish.